You are now more likely to die from an opioid overdose than a car crash. That's according to a new study from the National Safety Council.
The study found people in the U.S. have about a 1 in 103 chance of dying in a car crash over their lifetime, but a 1 in 96 chance of dying of an opioid overdose. News 8's Scott Behrens is in our studio now to tell us how a local coalition is trying to change those statistics.
The Centers for Disease Control and Prevention found Wisconsin had a 109% increase in emergency room visits from opioid overdoses from 2016 to 2017. A local group called Alliance to Heal says the best way to decrease opioid overdoses is to reduce who's exposed to the drug and improve the speed of getting addicts treatment.
Every month there are people dying from opioids in this community.
David Williams with the Institute for Healthcare Improvement says there are two key ways to combat the opioid epidemic in our area.
Unfortunately, many people encounter opioids through just traditional medicine.
The first approach is to give physicians guidelines to help figure out who should be given opioids and how much they should be prescribed.
Helping folks to know that there may be other alternatives to use than opioids, or if you do end up prescribing opioids, knowing that you want to make sure that you prescribe just enough or do it in such a way that you can titrate or reduce the amount that they use over time.
The second key approach, Williams says, is for doctors, EMTs, and other emergency personnel to get overdose victims both short-term and long-term help as soon as possible.
In the short term, helping them with their immediate need of using something like Narcan to reverse the effects of the drug. But in the longer term, it's about when you get to the hospital saying, how do we make sure that we connect you with services?
To simplify things, the Alliance to Heal wants to give people a single entry point for treatment.
Just having that singular entry point so that if they do desire recovery, they are able to find that resource easily.
If nothing is done, Williams says the problem will only get worse.
If you look at drug-related deaths in the community, a vast majority of them included prescription opioids, heroin, fentanyl, and so wanting to focus in on how to reduce the potential of people even being exposed to those drugs or having a fatal overdose from that is a key component.
Alliance to Heal is also exploring opening a detox center in La Crosse. The group isn't sure yet when it would come to the area, but thinks it will be another key component in combating opioid overdoses.
Thanks so much, Scott. And Cooley Council on Addiction says that right now the closest detox center is actually in Chippewa Falls.